So you're ready for your procedure, huh?
More than ready.
Are you nervous?
I'm actually not nervous at all.
So what was it that really made you decide to have liposuction by the tumescent technique, the local anesthesia technique?
Well, I told you before, I've been a triathlete for a year. I work out a lot. But even after races, I would see that nothing had changed. I'd work out a lot, and the same places would look exactly as they did before, while other parts of my body were obviously getting in shape. And I just felt like I wanted my body to reflect the fitness level that I'm actually at.
Yeah, it gets very frustrating as we get older when there's areas that are truly resistant to diet and exercise. And it's easy to do when you're 18, 19, 20 years old, but unfortunately as our metabolism slows down and we settle into the everyday routine, there's areas that really just stay kind of socked in there.
Yeah.
And that's where a minimally invasive technique like this tumescent technique really comes in handy in getting your body back into proportion, and then it just kind of stays there as you go through life.
Great.
All right. So you're back. After your first procedure, and gosh, you look great.
Thanks.
That's an amazing change for 1 week after surgery. So we did your full abdomen and your waist and hips all the way around. Swelling is pretty minimal in you at this point, and your incision sites are almost not even noticeable 1 week out. So what day was the worst part of the recovery?
Day 4, I think. I was hugely just swollen and bruised, and my boyfriend's taking care of me, and I thought, what was he going to think? And,
Yeah.
but it's ever since then, it's just been very
And that's typical. That's the way that these cases go almost to a T, is that you look immediately better the day or two after the procedure, and then you start to swell a little bit, kind of go in the reverse direction. But now, 1 week out, you're kind of way back down, and each day after this is just going to keep shrinking down more and more and more. So today we'll continue with the procedure, and we'll do the back of your arms like we talked about, and we'll finish off the reshaping to bring your lower half of your body into harmony with the upper half by doing the outer thighs and the inner thighs. You can see now, after slimming your waistline and your belly, it actually makes your outer thighs and your inner thighs even look a little bit bigger, because it's in proportion to what's sitting right next to it. So bring your legs out a little bit. So I will, as we do the outer thighs, I will feather it into the buttocks. We'll take part of the outer edge of the buttocks and slim that down as well a little bit. During this part, we're going to make our little incision sites just like we did last week. So just a little poke in the skin. Feel that. Well, you really can't beat this. You can learn about polar bears and have surgery at the same time. This is just all the local anesthesia to numb these areas up. You really have minimal bruising from that first procedure. I mean, you have a little fewer purple areas, but that's a tribute to you as a person for healing. You're right, and also to the solution that we use. It really keeps those blood vessels constricted. We're going to start the suctioning now, okay? So you should be nice and numb. You did good on the inner thighs. We're going to start on the outer thighs now, okay?
Okay.
So, inner thighs are pretty much done, yeah. Yeah, that was, the inner thighs are real soft fat, so it usually goes fairly quick, and we took out about 900 cc's of pure fat, so almost a full liter of fat. And we're just feathering into your buttocks so you don't make any step-offs. It's a common mistake made in liposuction. There should be a nice, smooth transition from that outer thigh into the buttocks. And by me having you awake and having you tighten and kind of clench that buttocks, it allows me to see kind of what you're going to look like when you stand up. Kind of lose that control when someone's asleep under general anesthesia. All right, finally done. How do you feel?
I actually feel great.
It's kind of a lot to go through when we do that many areas over the course of a couple weeks, but I'll tell you, it's going to be well worth it, and you did really, really good with the procedure. Congratulations.
Thank you.
And I'm going to see you in about 1 week for your follow-up for the arms, the inner and outer thighs. And then we'll see you in about 3 months where we'll come back in and we'll document all the changes that have been made.
Great.
In the meantime, just follow your instructions very carefully, what we gave you in the post-operative care. You can be fairly active for the next week, if not anything other than walking. And then in about 3 weeks, you can get back to your full normal activities. Okay? You call me if you have any other questions. All right.
Thank you.
Yep.